So with your hand, the pressure here, not too much? Okay. Can you close your hand into a fist?
Oh, that's too much.
Okay. So just as much as you can, comfortably. I'm going to back off just a hair. Is that better? Now close into a fist. Can you slowly, it's right at your edge, right?
Yeah.
Okay. Then slowly open your hand out. Can you pull your hand back this way? Just to your end range, wherever you can comfortably. And then close into a fist. Kind of an active pin and stretch. It's really hard for her to engage and close her own forearm flexors because I'm already pinning it, right? She has to slide. So let that guy go. Any tingles? Numbness in your hands? Because usually that's pretty normal. And I don't know if you guys can see this, but I want you to take a look at her hand and tell me if you notice how pale it looks. So very slowly, what I want you to do is I want you to keep your eyes on her hand and her fingers, okay? I'm going to very slowly take pressure off. Keep your eye on her hands and fingers. Arterial compression. It's not necessarily what I'm trying to do because I was trying to affect the forearm flexors. Like when you move your hand around now, how does that feel?
Feels great.
Yeah.
Feels way looser, just like there's no restriction in the forearm.
How difficult was it on my hands? Now, the secondary part, when I let go, what did you feel?
Oh, it's great. It's like a rush of warmth and like nerve healing and everything.
And I am quite nervous that your state regulatory board will make that illegal because they will say, no, you can't. And I'm like, can't what? Manipulate soft tissue? Make sense? So when you do Swedish, and let's say I was doing Swedish on her leg, does it have an effect on blood supply?
Yes.
But you wouldn't come in and put direct pressure on her femoral artery, would you?
I mean, if it wasn't gonna last for a long time and you're doing a pin and stretch, it's basically the same thing. Is it wrong or not?
So here's the thing. If you call it a blood stop, get into a weird area. How many clients want their blood stopped? Sounds dangerous. When I'm working the forearm flexors, there's a secondary component that happens on its own. As her arm lets go, as the muscles unwind, I'm having an effect on arterial structures. It's a secondary component. I'm not doing it just because it's a party trick. The reason I do it in that case where I make you watch your hand is as a visual demonstration. When you have carpal tunnel syndrome and you have inflammation, you have anitis, arthritis, appendicitis, right? What does blood flow do to inflammation? So what I want you to do is ask good questions. I don't tell people, I'm going to do a blood stop. They're very commonly done in Thai massage. They're done on the femoral artery in specific. They also happen on the arms. It's not a party trick. That's a very simple, easy kind of starting point to get going with that, to be able to explain to people, one, we're helping release their forearm flexors in a really great way. Another part that happens is I'm pressing her arm down into the table. Remember when I talked about the pain science community and skin stretching? What happens to her forearm extensors when they're on the table and I'm pushing them in?
They're getting compressed too.
It's their whole arm. It forms a tourniquet. It's an arterial tourniquet in combination with a soft tissue technique. And when I hold it for a while, people, normally I can almost time it sometimes on a mat. I'll wait about a minute and I go, are you getting some tingles or like numbness in your fingers? And they're like, yeah. But listen, they feel much more calm because I knew that was going to happen. And then what I do very slowly is I will step off and it's like a hose. You've crimped it and you go, flush that out. How did it feel?
Felt great.
Felt great. Not harmful, doesn't cause any issues. Do I do it on a lady who just had a stroke?
No.
Some guy who just had a heart attack, he's on blood pressure medication.
No.
Exactly, just common sense. When you hear blood stop, don't get afraid. They're just things that are used in Thai massage very commonly. When the compressions get bigger and broader, you're using your legs, your feet, your tuchus, you're sitting on people. Those happen just naturally along their limbs specifically. Okay?
So probably if people have embolisms, easier chance of having embolism if they are, so that you probably would never want to do that on them, correct?
Common sense. Yeah. Do you guys want to try that? You can use the pillowcase to dampen. Sometimes you can do it without. There's a difference when you use your knee and using this, ow, and then using like this. This is a bigger, broader structure, right? Like, in other words, when I did that, it wasn't sharp. Yeah. And I use this to dampen just a little bit as well, because sometimes this can be a little bit pointy along the tibia. I want you guys to try that. So you see how pale her hand has gotten?
Yes.
So just let your hand relax. And then what happens if you just lightly wiggle your fingers? Where did your hand want to go?
Not very far.
Not very far. Is it too much here?
Sometimes when you're doing Thai massage, it's like they're paying me to sit
And then
on
very
them.
slowly just look at her fingers. I'm going to start to release.
And whenever you're coming out of this, you want to make sure you're not.
It's like they rehydrate.
Oh my gosh. It's like numb almost.
Yeah. How does it feel now?
That's a lot easier than isolating.
So the forearm flexors and I'll go over this later. The forearm flexors and extensors are basically pulling across the carpet.
Right.
It almost feels like it's jamming
Yeah.
this.
Yeah.